The death of a mother, a newborn, or a child continues to affect sub-Saharan Africa, leading to untold suffering at household level. In Kenya, the maternal mortality rate is estimated at 362 per 100,000 live births. Most of these deaths are preventable if pregnant women receive the desired health care. Global Affairs Canada funded the Reproductive, Maternal, Newborn, Child Health and Nutrition program to address the issue. Implemented in 11 counties by 6 organizations, namely Action Against Hunger, Aga Khan Foundation, Amref Health Africa, Helen Keller International, Nutrition International, and World Vision Kenya in conjunction with the national and county governments. The project has been aiming to reduce maternal and child mortality by addressing issues related to the health of mothers, newborns, and children under the age of 5 years. To achieve the desired outcome, there was need to promote and support appropriate maternal health services for women and girls at all stages. Boosting their nutritional status was critical to improving maternal and newborn health.
We ensure that mothers are also educated on eating adequate diet during pregnancy, adhering to the antenatal clinics, taking iron and folic acid supplement so that the babies that they will give birth to will be healthy and will be ready even as they introduce to other forms of feeding. They will be already prepared and given that foundation to grow optimally.
I'm a beneficiary of WIPS. I'm 13 years old. The WIPS help in many ways in girls. The main one is that supplement, it is rich in iron, which help to add the blood that have been losing during our menstruation periods, and it also improves our immunity. It improves my concentration in class, because I remember when I started my menstruation period, I was feeling tired. I did not have any appetite. And now when Madam Hila came with that program, when my first day took that WIPS, I feel better. The boys usually ask why us are not given that supplement. I always explain to them that these supplements were given us as girls because we lose most blood during our menstruation period.
We've been running an adolescent nutrition and health program, which has a component of nutrition education among adolescent girls and boys, and weekly iron folic acid supplementation to our adolescent girls between the age of 9 to 19 years. We've also seen successes in terms of mainstreaming of nutrition education within the school activities, in relevant subjects and in relevant life skills among both boys and girls within that age bracket.
Undernutrition among pregnant women leads to increased risks of infection, anemia, lethargy and weakness, lower productivity, poor birth outcomes, maternal complications, and even death. Poor nutrition is also a significant risk to women and their newborns. Anemia or iron deficiency affects women of reproductive age 15 to 49 years, with as many as half of all pregnant women in low-income and middle-income countries diagnosed with the condition. To curb this, expectant mothers were encouraged to access iron and folic acid supplements to meet their own nutritional needs as well as those of the developing fetus. Evidence has shown that the use of iron and folic acid supplements is associated with a reduced risk of iron deficiency and anemia in pregnant women. However, to achieve the full life-saving potential, antenatal care promises pregnant women 8 antenatal contacts, 4 at the health facility and 4 at the community. Essential interventions on antenatal care include identification and management of obstetric complications such as preeclampsia, tetanus toxoid immunization, intermittent preventive treatment for malaria during pregnancy, and identification and management of infections including HIV, syphilis, and other sexually transmitted infections. ANC is also an opportunity to promote the use of skilled attendance at birth and healthy behaviors such as breastfeeding, early postnatal care, and planning for optimal pregnancy spacing. Health education sessions targeting men, women, and girls have been held with the sole aim of reducing child and maternal deaths. Here, participants are educated on different aspects of taking care of the mother and the unborn child. Interventions to promote the involvement of men in maternal, newborn, child health and nutrition are recommended to facilitate and support improved self-care, improve home care practices for the woman and a newborn, and improve the use of skilled care during pregnancy, childbirth and the postnatal period for women and newborns.
Nimekuwa nikitembea kwa nyumba, siongei na mama tena peke yake. Ninakaa na baba na mama wote wawili.
That perception, once it is changed at the community level, now you get a father coming with the baby or taking care of the mother or even coming into delivery room support. We have that men empowerment.
Kuna wazee wanaona hali za bibi zao labda haziko sawa sawa, wao wenyewe wamekubali kufanya family planning kutumia mipira.
My hope is that we can see the man coming in to support the lady more, because the father is very important in the life cycle of the child.
Through chief barazas and community dialogue systems, men have clearly understood their role in ensuring the safety of the mother and unborn child. Maternity open days were held as a way of educating expectant mothers on the need of adhering to antenatal visits. The joy of every parent is a safe delivery of a newborn as a result of skilled delivery at the healthcare facility. This is followed by strict adherence to postnatal care services, which are vital to guarantee the health of the mother and the newborn. Baby-friendly hospital initiative and baby-friendly community initiatives were put in place to ensure the child gets the best and the right start in life. At infancy, growth monitoring is essential to every healthcare worker through promoting early initiation of breastfeeding, exclusive breastfeeding, and complementary feeding up to 2 years. In early childhood, mothers are advised to adhere to the strict immunization timelines by visiting health centers. Vitamin A supplements are administered to children of 6 to 59 months. To make the process effective, community health workers, together with other healthcare providers, visit children in learning centers, children homes, daycare centers, slums, and farm plantations to provide vitamin A supplements to the children. This also strengthens the defaulter tracing mechanisms for vitamin A supplementation and immunization dropouts. At the health facility, vitamin A supplementation monitoring charts are distributed. This provides a monitoring system and ensures all children are reached with this service, which warrants proper growth for the child. As adolescents, the need for health education is fundamental. In schools, girls are taken through health education sessions, for example, nutrition, HIV prevention and treatment, teen pregnancies, and physical activity.
I think they're not bad because they boost our body, they make our body strong and even healthy. Because in our school I have seen changes since we started taking this medicine. Because some girls have started, including I, have started looking healthy than we were looking. Our teacher told us that it is good because it boosts our blood. Girls normally lose blood through menstruation.
When the body lacks a number of micronutrients, especially iron and vitamin A for the mothers and the children, then they are compromised.
The need to access quality, equitable reproductive, maternal, child and adolescent health services is critical for both rural and urban population. The girl child needs to be provided with iron supplements at adolescence, adhere to antenatal care, and postnatal clinics to guarantee better health outcomes for both mother and the child. In line with the Feminist International Assistance Policy, Canada will continue to promote gender equality and empower women and girls.